thank you. So we've got Dr. Alan McLellan from the Royal Free London Chase Farm Hospital, who's Medical Director at Chase Farm, so welcome. We've got Sarah Hayes, who's Chief Nurse at North Middlesex Hospital. And then we've got Bernie Burns, who's the Interim Macmillan Lead Nurse for Cancer, Palliative Care and End of Life. So welcome and thank you. And I just have to add in that as the questions were coming through, we could see that actually some of the questions were particularly maybe for Chase Farm, but equally that as hospitals, each hospital might have its own way of doing things. So at the last minute, luckily the Royal Free were able to join us. So thank you for rearranging your diary and coming in at short notice, Dr. McLellan. That's been really helpful. So without further ado, I'm going to just give you a 2-minute update on what Healthwatch have been doing, and then I will pass you over to the hospitals because I'm sure that's what you want to hear about. But I wanted to just give you a view that we've been working hard with the council. We've been part of the local resilience forum, and what we've also been doing is trying to play our part with our great volunteers who have been supporting us to support the local authorities befriending service, their Silver Line service. And what we've been doing there is making calls to check that people are okay, particularly those who are shielding and who are vulnerable, making sure they're getting their food parcels, helping them give information, that kind of stuff, and really just befriending calls on a regular basis. The other thing that we've been doing is keeping our website up to date and making sure that we've got, you know, up to date, credible, accessible information. So do come to our website if you actually need info and you're not sure about it. And the other thing I wanted to share with you, we have been doing lots and lots, but some of you would have joined us, I think, in those sunny days in March, before all of the pandemic broke out, and we had our annual conference. With everything kicking off as it did, we put our report on hold, but I'm glad to say that we will be launching it this week, so watch this space. And the key messages there are still relevant in terms of, you know, local people want to be communicated with, they want information that they can understand and their opinions. So that was me. I shall pass you on to Sarah. Sarah, are you able?
I am, sorry, I was struggling with the mute button. So hello everyone, I'm Sarah Hayes and I'm the Chief Nurse at North Middlesex Hospital. I just wanted to start really by thanking Healthwatch and members of our local community who've been incredible support to us through what's been a very difficult time. So a thank you from me and from everybody at North Mid. We were then going on just to, I've got a presentation that we're going to put up on the screen, just to talk you through the work that we've done to keep patients and staff safe at North Middlesex. Alan McGrennan's here as well from Royal Free, and Alan will talk as well from the Royal Free and the Chase Farm perspective as we go through each slide. Thank you. So
you want me to share the screen?
Would you, please?
So we're going to be technical now, and people who know me will laugh that I'm doing this, but hey, we're all learning. We're all learning new skills. So are you able to see that?
Yes, I am.
So I'm just going to put us on from the beginning.
Okay, so can we go on to the next slide?
Yeah.
So these are the things that I was just going to talk about, and this is very brief through this presentation. So how we at North Mid responded to COVID-19, what we've learned from this very new disease across the world, and how we're preparing for possible more waves of that disease, how we're bringing back services, because there are services that we had to stop during that very peak time, and how that's helping us to develop services at North Mid. And then just talking about new requirements around infection prevention and control, and how we want to prevent spread of COVID moving forward. So if we can go on to the next slide, please. So I think the main thing for us was that however much we could have prepared for a pandemic, as I said, COVID has been a very different thing for everybody in the world, and every country that experienced COVID has experienced it differently. And we faced what was a terrible threat to life, which we came together to prepare for. To do that, because things happened very fast, we had to come together as a hospital, but with our community and with our partners, to make some very different changes to our services and how we delivered services. And it has certainly impacted on us all in society. The other thing to say is that the evidence around the new disease, COVID, and the way that we treat it and the things that we do changes all of the time. It's, as I keep saying, it's a brand new disease that we're learning about. And certainly at North Mid, and I know across London and the country, we've learned and adapted our knowledge and our experience of COVID as time's gone on. We managed to meet the emergency surge in demand. We had a lot more patients needing our beds at that time. But we did manage to have enough beds for everybody. And as I've said, in order to do that, we really had to transform the way that we ran the hospital and the services. Alan, is there anything you want to say there?
Yeah, I mean, all I'd add to that is that some patients might have noticed, but certainly those staff, particularly those in management, would realise that the COVID response was sharing knowledge, of course, but equipment and staff and services. It was useful in a way that made us realise we can work better, which is one of the things we want to take into the future. The experience that they're all free was exactly similar, which was we had to make sure that we weren't overwhelmed for ITU or for medical beds, and we were not. But we had to take quite drastic reaction to make sure that that was the case, and that was redeployment of staff and services. So we took down an awful lot of our work that we were doing, which we're now in the process of restoring.
Thank you. So we'll just go on to the next slide. Oh, we've got it. I'm so sorry. So the things that we've learnt as we've gone along about this new disease, and that's helping us to prepare for future. And I talked about peaks. We don't know if there'll be another peak of COVID, but you'll have heard the government updates around that. So COVID, although we're out of that peak time, still remains a major threat to public health and to us all. And it does continue to infect some people who need hospital care, but that has reduced significantly in the last few weeks. It is an infectious disease. We are wearing masks in the hospital, and we are working very hard to minimise any spread of infection. We've got new infection prevention and control policies, and we receive guidance from the government on a sometimes daily basis, and changing of those policies as we learn and go on. And we are now required to change some of our services in order to minimise any risk of infection. We've talked a bit about, and Alan has, about new services and new ways of doing things, but it's also very important and given us the opportunity to look at those new ways of doing things in different ways, such as the telephone, digital consultations for outpatients, appointments, for example. And we want to look at and take the opportunity of having to do those things quickly, that if they're the right things for our patients, that we continue to do them. We want to learn with our patients and our community, and I think that's really important because COVID has impacted differently on every community, but also, of course, from the research and the best practice that we hear about and know about. And from North Mid, and I know at the Royal Free as well, we have participated in that research as we've gone on. Alan, anything from you there before we move on?
Only to say that the infection control is very much the liveliest issue that is in the hospitals at the moment. There are ever-changing guidance to keep patients and staff safe, and they have to be interpreted according to our real estate and our patient population. And so it's really difficult for us to get that right first time, every time. So they are constantly iterating and changing, which can be confusing. So we need feedback into that system, but also patience and understanding, and giving us some good feedback when we are communicating well, and letting us know when we need to do some more. I think we talk about that a little bit more later on, so I won't say any more.
Okay. So if we can go on to the next slide, please. So Alan talked a bit about it there, and I'll talk about all the way through around infection control. But as we've gone out of the peak of COVID, and I've talked about now we want to prevent people becoming infected again in the local community and in our hospital. So we are reorganising our services again across London and across the country into what we refer to as blue and green zones. And a blue zone is what we call COVID risk managed. So that would be for someone who is, there's a possibility, and there's a possibility for us all at the moment of having COVID. So that's most people. Of course we don't, but there is a possibility we can catch it. Or people or patients coming to see us who are confirmed to have COVID-19. And then we have a green, what we call COVID protected zone, which is for people coming to see us, for example, for surgery, who we are making very sure, because they've been isolating at home before they come in to see us, and we've swabbed them and various things to make sure that if they come to see for surgery, they're as safe as possible and not at risk of having COVID. So what we're doing is dedicating staff and equipment and facilities for each of those zones, and that fits with the infection controls guidance, so that people are not moving between and there's no risk of spreading COVID particularly into the green zone, but also minimising it in the blue zone. It's sensible at this time as well to minimise the need and the number of people that come to a hospital site. So I've talked a bit already about different options, for example, for our outpatients appointments, and that's certainly what we're looking at. And we've got new operating procedures, risk assessments and testing for COVID, to make sure that if you come to our hospital, you are as safe as you possibly can be. As we've said there, we do that in the ways that keep our staff safe as well, but give our patients the best health outcomes. And as Alan said, we want to listen to how you're feeling about that, and learn from everyone's experience as they come to see us. So Alan, is there anything else from you on that?
Yeah, just a few things, which is about, I think we've all seen quite a lot in the papers about members of staff who've died due to COVID, and we've also seen quite high infections in and around healthcare in general, and these are some of the lessons that we are learning. And I suspect quite a number of you have seen some of the documentaries, one of which had the Royal Free in it. We have made sure that at the very utmost is our ability to ensure that we are a very clean site and to communicate exactly what you're getting into. And that's why an awful lot of our outpatients will be face-to-face. Any work that can be done in the primary care, so general practice, that is a better place for it to take place. We are making sure that when we have face-to-face and hospital appointments, it's for a very good reason, and you're communicated to beforehand so that you're screened before you come in, even for an outpatient. For surgery and for more invasive procedures, so chemotherapy, there's an enhanced amount of preparation that is required before you come into the hospital to make sure that no infection is brought by you or given to you, and so that we can trace and track. Now, it means that it's quite it's a partnership in keeping the hospital clean. There's a lot that is being asked of the patient, and if we can reduce that, we will do, but at the moment that's the safest thing. The second thing to know is it does reduce our ability to be as efficient as we were, and this has come at a really bad time for the NHS, which needs to be more efficient. So we are keeping a very close eye on and making sure that we prioritise work, high priority, medium priority and low priority. So that has happened in a lot of surgeries, outpatient appointments and scan appointments. Thanks.
And the thing I'd say as well is that we're working very closely together across North Central London to make sure that all of those things we're doing that Alan described there, that we're doing across our hospitals, so that there's no variation for people using different hospitals across North Central London. Okay, let's go on to the next slide, please. So we've talked about infection control all the way through, and Alan's talked about it there as well. So just to say again that our priority is minimising the risk of infection. That now, that's the thing that we do in healthcare anyway, but even more now, it underpins all that we do every day. And we want to make sure, as Alan said, that you're careful very safely, and that our staff are careful very safely as well. So we are minimising what we call unplanned attendances at the hospital, and that is except for emergencies. So we would very much encourage, as normal, that you attend an emergency department if you need to do that. Alan's talked about planned appointments and the fact that we're screening and testing patients who come in for those. At North Mid, we're also regularly testing our staff, but we are discussing across North Central London the best approach to that, and the guidance for that changes rapidly. We've talked as well about minimising the need to attend hospital. The other thing that we've needed to do through the time that we've been dealing with COVID is make different arrangements for visiting, and that is for all the reasons that we've talked about around infection control. And we've introduced what we call virtual visiting, so being able to talk to relatives and loved ones via FaceTime or by Skype, and we've got devices on our wards to do that, because it is important to us that patients can keep in touch with their relatives. And we review visiting on a very regular basis, and again across North Central London we're making sure that we have the same approach to visiting, and Bernie's going to update us a little bit more about that shortly. Alan, is there anything else from you there? No.
No, I think we've covered the sort,
yeah,
the important points.
Yeah. So the next slide is just a summary there. So we're moving now from being in the very difficult emergency state that we were in during the peak of COVID to providing a full range of services for our patients. As Alan said, and I've said, we've had lots of learning during this time and lots of research, and we're constantly reviewing and thinking about what best practice is, and we will keep doing that, and we need you to feed back to us in order to do that. The most important thing for us is that we keep our patients, our staff and our community safe. So that's the end of that presentation. Priscilla?
Thank you. So hopefully that you found that helpful. I'm just going to have a quick look at the chat, and just seeing, I know we said, you know, we've got questions here to ask, but just given what you've heard, are there any questions there that anybody wants to ask in particular? Because otherwise I'll go to the questions that people have already put forward. So if you want to do a chat, you can just click on the speech bubble, and then you look, it says there to everyone, and then you can just go enter and then put your questions in. So I'm going to move on because I can't see anything coming through unless that's me. So, okay, without further ado, one of the first questions we've had, and actually we have heard generally from local people, is around blood tests. So the question, it says here, there's a couple of questions around it. There's one that says, I would like an update on getting blood tests in Enfield, and how do I get one?
Shall I start that?
Yeah.
So through the COVID period, we have still been carrying out what we'd call urgent blood tests. So people who've been identified by their GP as needing a blood test, we've still seen those people in hospital, but as I said, managing infection control procedures. We've now started providing clinics for our blood test at Forest Road Primary Care Centre in Enfield. And we'll build that up further to have more capacity to do that. What we're doing as well from mid-July is we're going to open a hub, we hope, for blood taking at the Selby Centre, which is very close to the hospital. That will help us support clearing the backlog of tests that weren't completed during COVID, so the non-urgent tests. and that's something we're working with colleagues across North Central London on. We're going to continue looking at community venues as a group of hospitals across North Central London for all of the reasons that I've said around infection control and making sure that it's as safe as possible for people to have that test. Alan, is there anything from you on that?
Yeah, I mean, I suppose it's a very similar experience in our acute sites, which is blood tests are similar to some of the other tests that go on in hospitals, whereby people just attend when it's convenient to them. Of course, that's a difficult issue in the time of COVID, and so we have concentrated a lot of our services at Chase Farm. The adult outpatient blood taking that was at Barnet and at Edgware is closed currently, and the paediatric provision at they're all free is still there. The important thing to know is we do want people to attend for blood tests with an appointment, and they tend to be given that, and they will be asked for evidence on that at the door. And a lot of information is in the confirmation text and email, but it's very confusing, I understand. There is quite a large section on the Royal Free website for those who feel that they've been given a bit of confused messaging. We don't want people to miss out on urgent tests that are to do with their medication, or blood tests as well. So be patient, have a look at the website, and we will expect people to, we know who they are before they come. And that's the safest thing. As soon as we can go back to how it was, we definitely will do, but that is not something that I can see happening in the next couple of weeks.
Okay, thank you. So that was helpful. So just to summarise, I guess what we're saying is really it's still with the hospitals for now, the North Mid and the Chase Farm, but there is a view to kind of opening that up safely, and I guess then you would speak to your GP. The GP would refer you, I'm assuming, and that's how then you would then access an appointment.
Yeah, unless you're already in a system and you're being monitored, and then it would be from the hospital specialty would be in contact.
And as Alan said, you'd have a letter or a text, something to show you that.
Brilliant. Okay, so it's just to be clear that we can't just trump up for a blood test. So. Okay, so the next question that's still relevant to this topic is around blood tests. Question here is, what are the procedures to take blood for patients with learning disabilities and especially with behaviour that challenges?
So I'll answer that first from North Mid's point of view. So our learning disabilities team in the hospital during this time and ongoing now, working very closely with the community learning disabilities teams. And if someone needs to have a blood test taken, we will support them to come to the hospital or to have their blood test done at home if that's easier for them. And our learning disabilities team have during this time and will continue to be part of that appointment to support with that. Okay,
that's helpful. And
right.
It's farm?
Yeah, I mean, it's similar across the whole of the Royal Free. We have liaison nurses at all of the hospitals who can help with advice and planning. And when we say planning, our advice by and large is we can give some intelligence on times when it's quieter, when it's beneficial to attend the hospital if there's any challenging behaviour. If more is needed, then there is always the possibility that we can make some reasonable adjustments. Again, we can be contacted through the website. And I don't know if we're talking about it later on, but the learning disabilities is really important at the Royal Free and in North Mid as well. It is a particular category of patient is looked at for health inequalities, particularly in, and this was before COVID, particularly for learning from deaths. It's a separate category. So all efforts to do with COVID and learning difficulties, disabilities is actually baked into how we do our work. Hopefully that'll provide some assurance. But as you would imagine, that this actually does, it is a high risk population for COVID, getting COVID, transmitting COVID. And so we want to make sure we are listening properly and actually inquiring ourselves about what issues are required.
Yeah, I mean, it's interesting because there's another question, just because you're mentioning, I was going to do it in the order that we got it through, but there was an issue about how you're supporting those with learning disabilities, particularly with the COVID deaths, and you know, what special measures are you putting in place to support them? Because clearly communication where people were going in on their own, hence its own challenges.
But it's difficult.
Go on,
yeah, sorry. No, go on, please go on.
So I think the first thing around sort of, visiting guidance is that for patients with learning disabilities, we've been very clear that they need support from their family or carer in the hospital. So that's the first thing. And we make sure that their family members can come into the hospital, but they are protected from COVID as well, in terms of being able to wear PPE and that we support them. Alan talked there about inequalities, and I know every hospital has been very aware of that as we've gone into the COVID period, and we knew that we would face a challenge around that. For us at North Mid, we've been very careful to review complex cases during the COVID peak time particularly, but the panel still carries on through what we call our ethics panel. And on there are doctors, nurses, our learning disabilities lead nurses there, our safeguarding lead, Healthwatch are also represented there, and what we call lay members, so representative patients. So any decisions there have very much been followed up through that process. Alan, I don't know if you talked a bit about it there, and it's a very similar thing across North Mid and Royal Free. Is there anything else you wanted to add on that?
The only other thing is that those who are involved in LD know of the hospital passport, but you'd be surprised at how many people don't who normally work in a hospital. So we've done quite a lot of communication to make sure that those who might be coming into contact with these areas through redeployment have had a little bit of education. As you can imagine, in the last 3 months, an awful lot of disruption has occurred and an awful lot of learning has happened, not always joined up. And so we have to keep going, and the hospital passport system being one of them.
Yeah. Bernie, is there anything you wanted to add at all there? You've been very involved around visiting and sadly around end-of-life care as well.
Yeah, I think, you know, it's really important as part of our visiting criteria. It's very much been around what's the benefit for our patients to give them the best possible outcome. So they have the option of relatives or carers visiting a little bit more frequently than maybe the rest of our patients. I think it's been very difficult, particularly through the COVID period, and these decisions are not made lightly, and so feedback, as everybody said, is really helpful and really important.
Thanks, Bernie, because there is another question that kind of links similarly to that. It's more around visiting for end-of-life care. So the question is, what's the policy for visiting for someone who is literally at end of life and you know, they're getting the telephone call that they don't have long to live?
I was just going to start by saying that across North Central London, we're making sure that we do the same thing on visiting, because I know how confusing national and local communication's been on that. Bernie's been leading that for us at North Mid, but I'm sure Alan will have comments too. But Bernie, if you maybe talk through the process and decisions.
Yeah, so throughout COVID, it became very clear that the hospitals had to go on lockdown to mostly protect the staff, but not mostly, but mostly the community and then our staff. And that was really difficult. I think, you know, when you're working in end of life or even as a healthcare professional, you know, you very much want to involve the family as part of the holistic care that we give. So the decisions we had to make were not easy, but we had to prioritise the health of everyone, and very much from an infection control perspective. Everything was taken through the ethics panel, any decision that we made about visiting, and also looking across North Central London. Currently, it's interesting. It's flipped a little bit, because the risk is probably now predominantly coming more from the community, and so we have to try to decrease the amount of footfall that's coming into the hospital, because that increases the risk of COVID coming back in. Our guidance is very much based on national guidance for both end of life and the general NHS national guidance. Visiting is subject to local discretion by trusts and NHS bodies, but as Sarah said, we communicate possibly weekly or very regularly with other hospitals within North Central London, so that we are all having the same guidance. I think the important thing to say is we need to keep everybody safe. Sorry, we have believe it or not, that my iPad is linked into virtual messages in the hospital. So I think that was a relative trying to get through to someone, be picked up by someone else. What was I saying? Yeah, I think we review it weekly. I do know it's very hard. Most of the complex situations actually come through me, and I assess it from a risk perspective. And we definitely will promote for people to come in and visit their loved one at end of life. Preferably, I would rather we identify people earlier, so that they can have a really good conversation with people before they really are at the end of life. That was very, very difficult during COVID, because unfortunately the rate at which people deteriorated was very unexpected and very rapid. But I think it's important to say we are revisiting it weekly. I do think we need to probably communicate it much more clearly, and we're working on that currently.
Yeah, I mean, I think there is definitely confusion, and I think there's probably some understanding with COVID. Is it any different? So if you're non-COVID, if you are, I say no, you're in hospital and you're frail and elderly, and there's nothing to do with COVID, is there any difference in that visiting policy?
Not currently, because the person who's coming to visit them is an unknown risk. So it's that unknown risk that we're currently protecting people against.
So hopefully that you could work on it on an individual basis, and obviously work with the families to look at how you can support them.
Absolutely, and very much. There were well over 100 devices donated, and we're working on communication projects, making sure that patients are able to communicate with their own families, but also that nursing staff and medical staff communicate with the person and their families on ward rounds, things like that, to increase communication.
Yeah, communication, whenever we've had any issue, it doesn't matter what it is, it's the communication.
Oh, absolutely.
If you can land that, then the rest of it becomes a little bit easier.
Yeah.
So, Sarah or Alan, any other comments? But I think
nothing from me, because Bernie's described North Mid there, but I'm sure Alan may want to come in.
Yeah, I mean, it's almost the same. They're all free, and Chase Farm doesn't tend to have inpatients who are dying, but they're all free. In Burnett, we have systems almost identical to that. They are very different to what they were pre-COVID, and I think most carers realise it's unsatisfactory and doing as much as they can to alleviate it, but maintaining that safety. I do think that whatever is in place at the moment will be very temporary. When we have a greater way of testing anybody coming through the door, so rapid swabbing that does exist in other countries, when that is throughout the NHS, it will change the complexion of the service that we'll be able to provide. At the moment, it's very much as North may have described it.
Okay. All right, well, thank you for that. I'm just going to move on to another question, just very straightforward and practical, because you've talked about infection control, but are there any extra hand washing or hand sanitizing facilities around the hospital?
Yeah. So shall I start on that? The biggest thing to prevent the spread of COVID-19 is to wash your hands. preferably actually with soap and water. As we had even our first cases of COVID in North Mid, we increased the amount of hand gel stations that we had. We've also put in extra sinks and hand wash facilities. We've got masks that we wear now as well. As we start to open up the hospital a little bit more, and we plan for that, we will have, and are putting in at the moment for North Mid, hand wash stations next to every entrance to the hospital, so that people coming into the hospital can wash their hands as they come in. Alan, I imagine it's very similar at the Royal Free.
Yeah, it's very similar in all three sites, and the additional thing to say is there's a cultural change that has gone on through hospital staff and volunteers, which is an absolute zero tolerance for anything other than the highest standards. So social distancing, wearing a mask, limiting the amount of people, washing their hands, bare below the elbow. Nobody's too grand to not be told to do their job, and that's something that is easily going. We all realise is going to change and remain afterwards, and that is a good thing that we've finally got to that position.
Yeah, because that doesn't just stop the spread of COVID. That's what we need to be doing in healthcare environments to stop the spread of any infection, and out in our homes and in the community as much as we possibly can.
And whilst we're on infection, and it's reassuring to hear these things, but I guess people are still nervous. So the question is here, what's your advice to those who are afraid of coming to hospital for a non-COVID reason?
Go on, Aaron. Go on, no, it's right.
Well, it depends exactly on the reason. I think the patient should feel well informed to make that decision themselves, and if not, they must go and seek out a healthcare professional to help them, be it their GP, pharmacist, or the specialist that they're under. We are very concerned that people are electing not to use our services for fear of gaining COVID, and I understand why. However, we have got a balancing act to perform, which is the risk of contracting COVID and the risk of not getting your treatment. So, for instance, those who there's a suspicion of having cancer and they need, say, an endoscopy, and people that are not wanting to attend to have that procedure because of COVID, I'm alarmed about it. And I'm making sure that all clinicians, when we've seen that, the clinician telephones that person to discuss them. But there are many things across the spectrum of healthcare that fits into that. So I suppose the best thing that I would say to you is the hospital will have considered your care. If they've invited you in for your test or your procedure, they think that you need it.
Yeah.
And you must attend. So if you were my brother, my sister, my father, and the North Middlesex asked you to come in, then I would advise you to go in. Okay, no, they've given it a lot of consideration.
That makes sense. And we've got a question on the opposite side of it, almost, because I kind of think if you've been asked, you really should go. But people are concerned around either cancellations or the long waits for referrals. So the message is coming through that, yes, absolutely, if you're worried, do seek medical advice. Mm. But then what we're hearing is, you know, I've had an appointment cancelled and I've been told to go back to the GP. Yep. Why can't I wait on the waiting list? There are a couple more because I might group them together. Yep. We've had another one saying about urgent referrals. We've had somebody who's elderly and vulnerable living in a sheltered housing. They've had 3 referral appointments cancelled at very short notice on the grounds that they were designated routine by the GP.
Yeah. Okay. Shall I start out?
Yeah.
Yes, please do.
So when COVID hit us, and it hit us very quickly and very hard, we were required across the NHS to make decisions about cancelling non-urgent appointments because we needed to free up what we call the capacity, the staff, and our resources to care for the increased number of patients who had COVID who came into our hospital. And for example, North Mid Hospital at the peak time was full of patients just with COVID. and we can't underestimate that. What we did at that time was go through with our consultant colleagues through the lists of people that needed to be seen, and we clinically prioritised who needed to be seen urgently and who needed to be seen routinely. What we're doing now, as we go back into a time where we restart services in the safe way that we've described, is going back through all of that information and organising appointments for people. I think the big thing I would say is that if anyone is concerned about their appointment and they feel that a wrong decision has been made, because obviously we were working very quickly and we had lots of what we call safety nets in place to make sure things were done right. But if anyone thinks that was a wrong decision, they need to, first thing would be talk to their GP. They can contact us at North Mid or Royal Free, wherever your appointment is, via our PALS team, and I would really encourage people to do that. And it goes back to what we were saying earlier, that we know everybody needs their care. We are also, of course, as I said in the presentation, looking at different ways of delivering appointments. So it may be that it's a phone appointment or an appointment online like this in the way that we're doing, but we're making sure that that's, if we do that, that's a safe way to do it, and that the people who need to come back into hospital for appointments are going to come in for that. Alan, is there anything you wanted to add on that?
No, nothing to add, except to say this is the area that we would quite like patience, but vigilance as well.
Yeah.
We've had to tear down our processes and re-establish them, not once or twice, but multiple times. It's extraordinarily confusing. I expect an awful lot of patients have received conflicting texts and paper and phone calls, and we apologise for that. Hopefully you get in the sense of why. We're in a period now, which is, we've come out of phase 1 where there's acute COVID on the wards and in intensive care. We're in our period whereby we're recovering and we're taking in order those patients who need to get it done first. And then we're thinking about phase 3, with this restoration of normal services. So that's the mentality of both trusts, and actually all the trusts throughout the country. But to do those 3 different phases requires 3 different priorities. And we've had to disestablish and establish stuff. So it's enormously confusing for the staff, let alone the patient. So patience, if you could, vigilance definitely, and if you're not sure, please contact somebody.
Yeah, I mean, I think going forward we need to all be aware of this factor, because again, you know, the messages are, if you're worried, go and see your GP, and yet then we know with the NHS backlog and waiting times, that actually there's a bottleneck and people are struggling, and they go back to the GP, and we're hearing even the GPs are saying, I don't know what else I can be doing. I've said it's urgent. So it's a real issue, I think, that obviously needs to be addressed.
It's really important to contact us, as I said. So that would be my biggest message. If you're concerned, it's easier to do that via the PALS team at the moment. So contact either PALS team and they will find out on your behalf. Okay.
And just, you were mentioning, Sarah, a little earlier about online and virtual appointments. So there's a question here saying, how will the North Middlesex, and equally, I suppose, Chase Farm, make online virtual health appointments accessible to those with additional digital access needs? So difficult getting online, maybe disability, poverty.
Yeah, so that's very important to us, and it's been a big part of our discussion. I don't have the answer yet. We're not going to ask anybody to digitally have an appointment if they say they can't. So I would go back to what I just said, that if you, for example, if you received a letter about a phone consultation or a consultation online, and it's something that you can't do, please call the number on top of that letter and please talk to us about it. We're working that through, and we are going to be talking to Healthwatch about how you think we would be able to do that, because it is tricky, isn't it? But as I said before, we don't want anyone to go without their appointments, so please speak to us about it.
No, okay, I think that's fair enough.
I guess the other thing I'd say is most of them are by telephone, and I appreciate some people haven't got telephone access either. But the majority of what we call as digital is actually, first line is going to be a phone consultation.
a telephone call.
Yeah.
And I guess we had the same question actually on the GP conference call, and sorry, I don't know that you'll have had a chance to look at this, but obviously we've got Simone on as BSL, and we're hearing lots of challenges for BSL for those who are deaf, and how they might then access.
Yeah, and again, that's something we'll want to work with Healthwatch around, just to get. I know how important it is for North Mid. You've already done some work with us in previous years around our community and our patients who are deaf. So that's something we'll be coming to you to talk about. So I don't have a perfect answer to that at the moment.
And it is challenging. I think again there was a question there around face masks, because I guess if nurses, everybody's wearing a face mask, and perhaps those deaf patients may be able to lip read, suddenly you're taking that away. So
we haven't got yet the clear face masks, but we are looking into getting those, because again, I understand how important that is. And it's also important for staff who are hard of hearing. So where we're asking staff at the moment to all wear masks. So it is something, we haven't got it now, but we're looking into it for a quick solution. Alan might have other things he wants to say about that.
No, nothing else. I mean, it's before COVID, the alternative ways of communication and attending were an opt-in, nice to have for those who wanted to make use of it. And now it's actually almost opt-out, and we're struggling with the health inequalities of that. We are looking at the metrics to see which ones we are to monitor, to see which areas we need to put our resource into. Also, we are purchasing more and more different platforms, and so that is always within our mind. We hope, but we look for the feedback of, but we hope that we're always able to offer something. If a telephone is not okay, then we can always do face-to-face. But as you can tell, what we want to do is limit footfall to the hospital.
No, that makes sense. A question again, really relating to the access of appointments and when will they be back online? So there's a specific one about a specific area. So how will North Mid provide diabetic eye check appointments for shielding patients?
Yes.
And a double-edged one with children's outpatients eye clinic be open again?
So we provide a lot of diabetic eye check appointments. The same thing as we talked about with outpatients appointments already, that we've carried on with what we would call the most important appointments, and most of those are routine appointments. We're not yet able to do appointments on top of that, but we are reviewing across the service, and we will hope to have that in place quite soon. But we are making those checks to make sure the people that need them now are having them. Paediatric outpatients, we provided during the time a lot of our paediatric inpatient services were moved to Great Ormond Street Hospital, but we carried on with urgent outpatients appointments here at North Mid, and the same thing applies that we've talked about with adult outpatients appointments, that they're coming now back online. If you've got any difficulties, please contact us to have a discussion about it.
So the message to the local community is bear with us. Outpatients appointments are coming back, but you do need to kind of persevere. I think Alan, you mentioned the word vigilant, so that don't just ignore it or leave it. But equally, if you're stuck in the system, do follow it up. Contact if it's PALS or for Chase Farm, telephone, ring them.
Yes, I mean, just to give some sort of timelines for. Throughout the whole of the Royal Free London, we have reallocated the outpatient programme, and that means that we acknowledge that a lot more is taking place virtually, face-to-face, sometimes with a webcam, and we have had to change how where we provide the face-to-face. A lot of it is actually at Chase Farm, but it's changed the templates around so that we can make sure that we can provide the right amount. In some areas it's much more efficient, in some areas it's less, and so we have to do a rebalancing. So again, it's a house of cards that's fallen down and we're restacking it again, and so that has actually taken place this week, all of this, So a little bit of patience, but yes, vigilance, and to be expecting pretty much all services to be up and running from an outpatient point of view from next week.
Okay.
But there'll be the prioritisation that I spoke
Sure.
about.
Okay, but that's good news. I'm just conscious of our time, so I'm going to speed us through a couple of questions, and I think one that's been waiting on the chat. The question here is actually for your staff. How are you supporting your Black and ethnic minority staff at work? Obviously, given all of the conversations, you did mention it earlier, so maybe just a brief response would be helpful.
Shall I start that? So
Yeah.
64% of our workforce at North Mid are from a BAME background, so this has been very important to us through the COVID period and is anyway. And there's been lots of national discussion about inequalities for people from a BAME background. We have signed up and have been part of developing a risk assessment for BAME staff working in London, and all of our staff are having that risk assessment. And that's categorised, and it includes if people need to not be working with patients, for example. We have a whole health and wellbeing support offer, which includes counselling, all sorts of things that we've provided and will continue to provide. And with our BAME staff particularly, we're running at the moment a number of listening events to understand what this means for them with COVID and how we can support them. Alan, I'm sure it's a similar thing for you.
Yeah, we're getting a very accurate opinion and a bit more detailed than we'd ever done in the past. We're going hell for leather with the assessments, and that's already begun in some areas. I think it was only released this week. In some areas, it's past 25% of all staff. We realised that this is not necessarily just a biological issue. With the infection rate, this is a racism issue. I think there's really impressive conversations that are going on at the executive committee level. In fact, this morning at GEC, our largest executive committee, that was the topic of conversation. There'll be real change, but the support, which is to answer the question, is every single member staff is getting risk assessed. There is ample opportunity for those who need to shield. There is a lot of variable working that is going on across the Royal Free. We expect everybody to be accommodated according to their needs and actually probably according to their wishes as well.
Okay, so similar. Thank you. That's helpful. I'm just going to try and get a last minute last minute questions from the chat actually. So one's around dementia. It says, and if we can have just quick brief answers, and if it's the same, just say the same, and then I'll move on to the next one. Do you feel that the staff have had sufficient knowledge about dementia to help in the absence of their carers or family? If not, how can Enfield Dementia Action Alliance help as we go forward? They've mentioned Healthwatch, but this was about Enfield Dementia.
Okay, my very quick answer to that is we've been doing a lot of work for the last 3 years. And so if that organisation felt that we weren't, we'd love to hear from them. We think we've got a very dementia-friendly staffing complement. So if there's more we can do, we'd really like to hear it.
Same for us. I think Enfield Dementia Action are on our dementia steering group, and we've been having lots of discussions through the COVID period, but very similar to what Alan's just said.
Great, it's reassuring. And then we had another question. It says here, UCL have opened their GP X-ray access service. When will the North Mid and Chase Farm do so?
Well, it rather depends. So across the sector, imaging, all areas have come together to make sure that we prioritise the work done in the imaging centres according to need. And so if it's unrelated to whether it's GP initiated or hospital initiated. So if it's high priority, it'll be done. There is an awful lot of backlog throughout the whole of the sector, something like 100,000 image captures. A lot of those are x-rays, plain films, not scans. An awful lot are ultrasounds as well. The prioritisation is in the hands of the GPs at the moment. It's nearly completed in the hospital settings already. So the services are already running. the full access and full capacity that we had before. It'll be a long time before that returns, but the prioritisation has started.
I think the thing to say as well in terms of infection control, we can do a lot less imaging and x-rays now than we could before. We required a need to clean in between each procedure, etc. So that unfortunately slows things down as well. So nothing more to add, we're part of that process too, but just to bear with us again with that.
So that's a very good point. We can do about 65% of the work we did before because the amount of time that it takes to clean and let it air. And then we're looking at other provision, which at the moment is happening in the independent sector. That won't last forever. There are plans for the whole sector to say, what will we need for a substantial amount of time, and do we need to invest? That's the limit of the conversation at the moment.
Lots of big questions there that are open, and that I think it's just being aware and knowing and keeping the dialogue open and keeping the communication open. So I just want to draw the conversation to an end. So I just wanted to firstly say thank you very much to the panellists, to Alan, Sarah, to Bernie, Simone for signing, and to all of you listeners. Do complete the evaluation sheets, but the evaluation online survey, because again that helps us improve. What we will be doing is we will be sharing the slides from the presentation from Sarah, if that's okay. And when we're organised to do so, we've got the recording, so we'd be looking to put that up on our website. And actually Emma's kindly put the link to the survey on the chat so that you've got it straight away in case. That we'll be sharing this recording so that if people, you know, that you're aware of weren't able to make this session, that they can actually listen to it thereafter. And if there were any other questions that came through, what we'll do is we will ensure that both hospital trusts are able to respond to those, and ideally we'll be able to put the kind of Q&A sheet together at some point in the next week or two to have that up on the website as well. So I just want to say thank you all for listening, and I hope you'll join us. We've got another session now with Burnett, Enfield and Haringey Mental Health Trust on mental health on the 7th of July between 1 and 2 p.m. So do join us then, and thank you again for joining us. Okay.
Thank you.
Thanks.
Thank you.
Bye-bye.
Bye.